I just feel so bad because he never asked for it.
Debra Kabel says her husband Michael has been through the ringer.
So this is a picture of Michael from January at the VA.
After a fall in November of last year seriously injured his spine, part of Michael's recovery included about 10 days at Colonial Heights Rehabilitation and Nursing Center.
And about 5 days in, he said, "You need to get me out of here. I hate it here."
Debra says her husband often complained about a lack of attention from staff.
Things that he would tell me that they weren't turning him, they weren't feeding him, they were doing just bare minimum care for him.
And her worries hit a breaking point on day 9.
One of the younger nurses came in to turn him and do his wound care, and I was like, "What wound are you talking about?" And she said, "Oh, he has this bed sore back here." And that was news to me.
Debra showed me a picture of the wound, which is too graphic to broadcast.
I mean, it's just like an open valley. It's terrible.
Debra says she had her husband transported by ambulance to a hospital the following day. Nursing home records show that Michael was admitted to the facility with a stage 2 bed sore, and by the end of his stay, it had progressed to an unstageable level that was worsening with overall decline. A spokesperson for Colonial Heights declined to comment on our questions about Michael's care. But we do know through a state inspection that was initiated in late December after 18 employees there were arrested in an elder abuse investigation that the facility failed to provide care and services for pressure injuries. The report surveyed a sample of residents, not including Michael, and it states that staff failed to give residents prescribed treatments to prevent wounds and failed to reposition a resident every 2 hours. In fact, the report says that a nurse trained in wound care told investigators that she had not done treatments in a long time because she was pulled to other tasks due to staffing issues. Inspectors faulted the nursing home for failing to maintain adequate staffing, and the report even notes that when they were short-staffed, employees had a saying that went, "Keep them alive, off the floor, clean and dry."
Where is all the money going? Because these facilities are not exactly cheap. And yes, I understand that most people are there for Medicare, Medicaid, and whatnot, but that doesn't mean you shouldn't be taking care of them.
CBS 6 requested cost reports to get that answer. Nursing facilities have to submit these forms to state and federal regulators. Since the majority of their funding comes from Medicare and Medicaid, taxpayer dollars, these documents are supposed to show how the money is being spent. According to the Health Department, Colonial Heights is a for-profit facility owned by Virginia Care Holdco, LLC, and operated by Medical Facilities of America. It reported about $8 million in profits between 2020 and 2023, but last year, the provider claimed an $89,000 loss. However, experts who reviewed these records believe there's more to that story.
This facility was highly profitable, but they don't show the profits at the nursing home.
Ernest Tosh, a nursing home attorney and financial analyst, says that true profits can appear unclear due to something called related party transactions. That's when the facility does business with other companies, like a real estate company, that are all under common ownership, and those transactions appear as operating expenses on the cost reports. But recent research of the industry overall has suggested that expenses among interrelated parties could be inflated to mask profits. A 2023 report from the legislative branch that advises Congress on Medicaid said it was concerned about the potential for related party transactions to increase costs above what would be expected for an economically operated facility.
Because you own the real estate company as well as the nursing home, you could overpay on rent. And what that does is it sucks all the money out of the nursing home and makes it look like it's unprofitable.
And that's what Tosh suspects might be happening at Colonial Heights. The nursing home discloses on its state cost report that a related party owns the property of the facility and then charges itself rent. But the price of that rent increased significantly from $2.6 million in 2022 to $6.1 million just 2 years later.
That is a highly unusual, extremely large transaction.
Julian Rich, a former nursing home administrator and expert witness who also analyzed these cost reports, had a similar reaction.
One of the most disturbing things in everything I looked at is that they are paying exorbitant amounts of rent.
While Tasha's data finds that rent, on average in Virginia, makes up about 10% of a facility's operating expenses, Colonial Heights' rent last year made up 25%. That's the highest number that Rich says he has ever seen.
The most, number one, by far. By far. I've never seen more than 10% rent in any of the cases I've looked at.
Now, the facility also claimed more than $500,000 in related party transactions for administrative cost, but it did not disclose which companies they were on its report. Virginia's Medicaid agency, DMAS, says the nursing home should identify those costs, but adds this is not always done accurately by providers. DMAS says it is now inquiring whether Colonial Heights paid management and consulting fees to its own companies, Innovative Healthcare Management and Medical Facilities of America. While DMAS says that Colonial Heights disputes that those companies are under common ownership, it says the facility has not provided sufficient documentation to prove it. On federal cost reports, the facility does not disclose any related transactions, including the millions it paid itself in rent.
That is for sure a problem because according to CMS regulation on the federal cost report, you have to reveal all related party transactions.
When we asked whether the facility believed its rent payments to related owners were reasonable, spokesperson Mindy Barnett said, "The rents are believed to be fair market value, and all governmental filings were submitted by qualified professionals who are not identified in any irregularities." Barnett did not directly answer questions about the non-disclosure of other related parties. Experts say it's important to analyze the finances because they tell you how much money is or isn't going towards direct care. For most nursing homes, Tosh says that labor is one of the biggest expenses. At Colonial Heights, he says the latest payroll data from 2024 shows the facility staffed registered nurses significantly below what the federal government proposed as the minimum standard to provide safe care. Tosh estimates it would have cost the nursing home an extra $2.7 million last year to bring staffing up to that level.
The number one most expensive employee in a nursing home is registered nurses, RNs. So you cut that group to the bone, that's going to maximize profits.
We asked Barnett whether Colonial Heights was indeed profitable in 2024 and whether low staffing was a cost-cutting measure, and she did not answer those questions. She did send a statement saying, "The information is incorrect and out of context. We understand the intense scrutiny and salacious nature of the news cycle. 18 members of our staff were arrested and prevented from caring for residents. We look forward to the conclusions of these matters so we can freely defend the quality caregivers and our community." She did not provide further comment when asked to explain exactly what information is inaccurate.
I'm not saying that they shouldn't make a profit, but how much should that profit really be? Because there's really no reason that you couldn't give great care and still take home a decent paycheck.
Debra says she understands providers need to make money, but in a way that's transparent. She's now calling for stronger laws at the state level surrounding financial reporting and ownership oversight.
And you need to enforce laws based on nursing homes that are substandard and prosecute those for this lack of care, because this definitely needs to change.